Cancer is one of the most dangerous and widespread diseases in the modern world. Unlike infectious diseases that are caused by bacteria or viruses, cancer is a condition where cells in the body start growing uncontrollably. These abnormal cells form tumors, spread to other organs, and eventually disrupt the body's ability to function. According to the World Health Organization, WHO, cancer is the second leading cause of death globally. In 2020 alone, nearly 10 million people died from cancer. Every family, in every country, has been touched by this disease in some way. What causes cancer? Cancer does not have a single cause. Instead, it develops due to a combination of factors. Genetics: some people inherit defective genes that make them more likely to develop cancer. Lifestyle: smoking, alcohol consumption, poor diet, and lack of exercise increase the risk. Environmental factors: pollution, radiation, and exposure to harmful chemicals can damage cells. Infections: certain viruses, like HPV, hepatitis B, and Epstein-Barr, are linked to cancer. Cancer develops slowly. A healthy cell becomes abnormal, grows into a tumor, and can eventually spread, metastasize, to other parts of the body. The most common types of cancer. Lung cancer, the leading cause of cancer death, strongly linked to smoking and air pollution. Breast cancer, the most common cancer in women, though men can also develop it. Colorectal cancer, affects the large intestine and rectum, often caused by poor diet and genetics. Prostate cancer, common among men, especially those over 50. Stomach and liver cancer, more frequent in Asia due to dietary habits and infections. Warning signs of cancer. Early detection saves lives. Some common warning signs include unexplained weight loss, constant fatigue, long-lasting cough or hoarseness, unusual lumps or swelling, persistent pain, changes in skin, moles, spots, wounds that don't heal, abnormal bleeding. Many people ignore these symptoms until it is too late. That's why regular medical checkups are critical. Global statistics. 10 million deaths per year. Cancer is one of the biggest killers in the world. 1 in 6 deaths worldwide is due to cancer. By 2040, cancer cases are expected to rise to 29 million annually. Developing countries are hit hardest because of weaker healthcare systems. How is cancer treated? Surgery, removing tumors physically. Chemotherapy, using drugs to kill cancer cells. Radiation therapy, targeting tumors with high-energy rays. Immunotherapy, boosting the body's immune system to fight cancer. Targeted therapy, newer drugs that attack specific cancer cells without harming healthy ones. Each treatment has side effects, but combined approaches, known as multimodal therapy, often give the best results. How can cancer be prevented? The good news is that 40% of cancers are preventable. Here's how. Quit smoking. Limit alcohol. Eat fruits, vegetables, and whole grains. Exercise regularly. Maintain a healthy weight. Protect your skin from the sun. Get vaccinated. HPV and hepatitis B vaccines prevent related cancers. Go for regular screenings, mammograms, colonoscopies, pap smears. The future of cancer research. Scientists are working hard to improve treatments. New innovations include AI and machine learning to detect cancer earlier. Gene editing, CRISPR, to correct defective DNA. Personalized medicine, where treatment is designed for each patient's genetic makeup. Cancer vaccines that train the immune system to destroy tumors. Conclusion. Cancer is one of the greatest health challenges of our time. It doesn't discriminate between rich or poor, young or old. But with early detection, lifestyle changes, modern treatments, and global cooperation, millions of lives can be saved. The fight against cancer is ongoing, and awareness is the first step. By understanding the risks and taking preventive action, we can protect ourselves and future generations. Cancer, the global health crisis we can't ignore. Introduction. Imagine a disease that affects every country, every family, and nearly every community in the world. That disease is cancer. It is one of the leading causes of death globally, responsible for nearly 10 million deaths every year. That means cancer kills more people annually than HIV, malaria, and tuberculosis combined. But what exactly is cancer? And why is it such a difficult disease to fight? What is cancer? Cancer happens when normal cells in the body start growing uncontrollably. Instead of dying when they should, these cells keep multiplying, forming tumors. Some tumors stay in one place, but dangerous cancers can spread to other parts of the body. This process is called metastasis. Main causes of cancer. There isn't one single cause of cancer. Instead, it is triggered by a mix of factors. Lifestyle choices, smoking, drinking alcohol, poor diet, and lack of exercise. Environment, air pollution, exposure to harmful chemicals, or radiation. Infections, viruses like HPV and hepatitis B can cause cancer. Genetics, family history plays a big role. The truth is, anyone can get cancer, but our choices and environment can greatly increase or decrease the risk. The most common types. Lung cancer, often linked to smoking and air pollution, the deadliest form worldwide. Breast cancer, the most common cancer in women. Colorectal cancer, affects the digestive system and is rising due to poor diets. Prostate cancer, common in older men. Stomach and liver cancers, particularly high in Asia. Warning signs you shouldn't ignore. Cancer is most dangerous when discovered late. Some warning signs include unexplained weight loss, unusual lumps, long-lasting cough, skin changes or wounds that don't heal, abnormal bleeding. Early detection can literally save lives. Global impact. 1 in every 6 deaths is caused by cancer. By 2040, the number of new cancer cases is expected to reach 29 million per year. Low- and middle-income countries suffer the most because of limited access to screening and treatment. Treatment options. Doctors use different methods depending on the type and stage. Surgery, removing tumors. Chemotherapy, powerful drugs that kill cancer cells. Radiation therapy, high-energy rays to target tumors. Immunotherapy, boosts the immune system. Targeted therapy, attacks only cancer cells, sparing healthy ones. No treatment is easy, but many patients today live much longer thanks to medical progress. Prevention, what we can do. The hopeful news is that about 40% of cancers are preventable. Simple lifestyle changes can protect us. Don't smoke. Eat more fruits and vegetables. Stay active and maintain a healthy weight. Limit alcohol. Protect skin from too much sun. Get vaccinated against HPV and hepatitis B. Go for regular health checkups. The future of cancer research. Science is advancing rapidly. Researchers are testing artificial intelligence to detect cancer earlier. Gene editing to fix faulty DNA. Cancer vaccines that train the immune system to destroy tumors. The fight is far from over, but there is hope. Conclusion. Cancer is one of humanity's greatest challenges. It touches rich and poor, young and old. But by raising awareness, promoting prevention, and supporting research, we can change the future. The message is clear: early action saves lives. Together, we can fight cancer and reduce its impact on our world.